Hey guys, Dr. Ryan Godfrey here with Body Therapy Inc. I wanted to take time today to talk about one of the most neglected shoulder joints when we're talking about having shoulder pain or restrictions with overhead mobility, and that's the sternoclavicular joint. Typically we think of our glenohumeral joint, which is that ball and socket joint. We also have to take in consideration the acromioclavicular joint, sternoclavicular joints, and scapulothoracic joint, the way that shoulder blade moves on the mid-back. But today specifically, we're going to be talking sternoclavicular joint. So this can get really tacked down, and there's one muscle in particular, your subclavius, that attaches from your first rib to that clavicle. And the goal of that muscle is to depress that clavicle at the SC joint to get more overhead positioning. So a way I like to start freeing up some of that area is just, you can take the pads of your fingers right on the underside of your collarbone and free up tension to that subclavius, or you could take a lacrosse ball. It's usually a pretty good tender spot. So I'll just rub in that area for 30 seconds to a minute each side. And then we can do a joint mobilization of this sternoclavicular joint. So the way to do that, I'll just get the pads of my fingers right on top of my collarbone, bring that other hand right around, and then work on just diaphragmatically breathing in this position. So I can work 5 to 10 repetitions of that, and that's going to drive that collarbone downward inferiorly so I can clear more overhead movement. And one of the other drills that I like to add in for that overhead positioning is adding some weight to that position. Now I can use that opposite hand again to pull downward on my collarbone as I drive that weight slowly up overhead. So I want you to try that progress for your warm-up next time you're doing any overhead work, whether it be CrossFit, weightlifting, or if you are dealing with shoulder pain, that might be one of the areas that's causing trouble. If this doesn't help, make sure you seek out a clinician that can give you some hands-on work and start working on that area to free up any residual pain that you might have.